Good morning. Happy Monday on the last day of October 2022. Good morning, everyone. Today, it's going to be lit. We're talking about stroke um, since it is World Stroke Day. So I know I'm actually on time, but early. So I'm going to do this for the next couple of minutes so that we all know what's today's mandate. Okay. This thing not sharing my screen. Oh, we're having that problem again with the browser not being able to share the screen. Yo, my goodness. Let's try it again. Welcome, Ona. Welcome, Sir Richard. Welcome. I thought it's sharing. Um, let me try it again. Let's see. Okay. Now it seems like it's working. Sorry about that, great leaders. Sorry, I apologize. All right, so today we are talking about stroke. We're going to define what is a stroke. We need to know and understand what is a stroke, so we need to define it, and then we need to know the types of stroke that you get, as you get different types. Thank you, Sir Richard. Thank you so much. And then we need to also understand the signs and symptoms of a stroke. All right, then we move on to the causes. What causes any type of stroke? Welcome, Didantombi. And then we need to know what kind of treatments are available. Obviously, we won't do all of them, but I will touch on a few of them. So we also need to understand, okay, that after treatment, the kind of treatment that is available out there, and then I'm going to give you the recommended long reach products that you as a distributor can recommend to your clients, prospects, or team members, because we do have teams, right, that also go through such, and they also have their own team. So your success line, basically. Welcome, Leader Mutakela. And then I'm going to open the floor up for questions. Because this is a very important topic, I will only take questions pertaining to CVD, cardiovascular diseases, today. All right, since it is World Stroke Week or International Stroke Week. Are we together, great leaders? And then I kindly ask that we please share the training link with our respective partners or your clients. Is not a problem. Remember, our trainings are not just for Longish members. They are also for non-members as well. Why? Because Longish products are for everyone. All right, and we need to create awareness and get our products to the people. Let people know that Longish also has products for stroke survivors, that is. All right, are we together, great leaders? All right, so those are the things that will be covered. Definition, we're going to define the stroke, types of stroke, signs of stroke, causes of stroke, treatment, and long-range recommendations, and then I give the floor over to you. Please save your questions for later. All right. Thank you so much, Sir Richard. Save your questions for later so that I can concentrate and get this training going. All right. If there is time, I will also share a video done by one of the doctors at Mayo Clinic. Let us begin training. Welcome, everyone. For the leaders that do not know me, my name is Pulane Mutimwen, all the way from South Africa, your global product specialist. I also have a YouTube page that you can knock yourself out with, where I train you on products as well. This training will also be uploaded to my YouTube channel afterwards. All right, so you can also like and subscribe on my YouTube channel. Just search for Pulane Long Reach. You'll see it says Pulane Long Reach Product Specialist. Yeah, something like that. Just go Pulane Long Reach. You can see my name there, Pulane. Pulane Longreach, and then you'll see my page. Just like, subscribe, and share, and just knock yourself out. There's a lot of videos, over 100 videos there, pertaining to training on the Health Hub and other kind of stuff, like product training specifically, that I've been doing since actually 2019, but it became official in 2020. All right, ladies and gents, let us start the training. So, like today, we're going to talk about strokes. And then there's no way that I can talk about stroke and not talk about the brothers and the sisters, which is the cardiovascular diseases. So let's start with causes of a stroke. What? No. We need to know first, what is a stroke? Okay. All right. Every day in South Africa, nearly 240 people will suffer a stroke, of which they will claim nearly 70 lives. Some people who survive a stroke will recover fully, but many people will be left with long-lasting disabilities. Strokes not only affect the survivor's ability to live a normal life, but can also have devastating consequences for their loved ones. So we also need to bear in mind that you having a stroke or anyone having a stroke is not about that individual only. It's also about the family members. Because remember, we also have to take care of you. We also have to understand what you're going through and how we can help you. Remember that. All right. So that's why everybody actually needs to be in this training, so that we can know and understand about stroke in almost its entirety. So what is a stroke? It's a healthy network of blood vessels. Okay, a healthy network of blood vessels is vital to your brain, as it requires an uninterrupted supply of fresh blood filled with oxygen and nutrients. I need you to mark this one: oxygen and nutrients, especially the nutrients part. Blood is pumped from the heart to the brain by two large blood vessels called carotid arteries. As the carotid arteries reach the brain, they divide into a fine network of very small blood vessels that supply blood to all the brain cells and the different parts of the brain. A stroke happens when the blood supply to the brain is interrupted. All right, when the blood supply of the brain, let me try highlight. Right? When the blood supply to the brain is interrupted is when a stroke happens. Remember in the beginning, we said it requires an uninterrupted supply of fresh blood filled with oxygen and nutrients. Moving on. One of the arteries carrying oxygen and nutrients to a part of the brain suddenly becomes blocked or bursts. This means that part of the brain does not receive the blood it needs. So the affected brain cells are damaged and some die. During a stroke, parts of the brain may be permanently damaged, causing the person to experience the symptoms of stroke. It is very similar to what happens in a heart attack, so it's often referred to as a brain attack. Welcome, Leader John. All right, moving on. Most strokes can be prevented by a healthy lifestyle and treating conditions such as high blood pressure or cholesterol and diabetes. Please write these down. Most strokes can be prevented by a healthy lifestyle. Remember, I always say everything always go back to your lifestyle. And treating conditions such as hypertension or cholesterol and diabetes. We together now. We've defined what is a stroke, right? When there's an interruption of blood supply to the brain. So that's a stroke. Now you get different kinds of strokes. All right, let's see the type of strokes. All right, although all strokes interrupt blood flow to a part of the brain, there are different types of strokes that affect the brain differently and that are treated completely differently. Ladies and gentlemen, I'm reading from the Heart Foundation website, or otherwise known as the Heart and Stroke Foundation. All right, welcome to Judith. So we're done with the defining of the stroke. Now we're doing types of stroke. All right, you also get strokes in children, so let's get that out of the way. It is a myth that only older adults have strokes. While people over the age of 65 are at a higher risk of having a stroke, a person of any age, mark that, any age can actually have a stroke, including teenagers, children, newborns, and even unborn babies. Although estimates vary, strokes affect about 6 in 100,000 children. Moving on, so children can also be affected by stroke. Now, there's something called amaurosis fugax. It is a medical term that simply means a blood clot. All right, it means a blood clot has become lodged or stuck in the blood vessel at the back of the eye, causing loss of vision. This is a type of TIA, otherwise known as transient ischemic attack. It's a type of TIA that affects the eye and should be investigated by your doctor to prevent a stroke from occurring in the future. People often say it feels like the light is fading and a curtain is being pulled over their eye. The blood clot usually breaks up naturally and the eyesight recovers. All right? So we also have stroke, type of stroke that affects the eye. Now, moving on to the mini stroke or the TIA, transient ischemic attack. This is also known as a mini stroke or a warning stroke. A TIA is similar but less severe than a full-blown stroke. Most TIAs usually last a short time, about 10 to 15 minutes, and the person will recover within 24 hours. If you have a TIA, you will have the same symptoms as if you were having a stroke, but you will recover quickly and the TIA won't usually cause permanent damage to your brain. A mini stroke is a warning sign that a more severe stroke may be coming at some point in the future. So it needs to be taken seriously and should not be ignored. I hope you're taking notes on this or you're taking screenshots. It should not be ignored. A mini stroke is a warning sign. Therefore, it should be taken seriously and should not be ignored. It is vital to get immediate medical attention if you think you have had a TIA, as a proper medical treatment can reduce your chances of having another TIA and prevent a fatal or disabling stroke. Obviously, when we say fatal, means you die. Disabling obviously means you no longer 100% like before. Medical treatment may be necessary to prevent a full-blown stroke from happening. All right, moving on to hemorrhage. Hemorrhage strokes caused by bleeding. When a blood vessel in the brain bursts or ruptures, it bleeds into the brain and damages it. Ladies and gentlemen, in September, remember there was a time where I was doing the trainings at a foreign area place. We buried an aunt of mine who had just this hemorrhagic stroke. All right. When a blood vessel in the brain bursts, it bleeds into the brain and damages it. The medical term for this is cerebral hemorrhage, all right, which simply means bleeding in the brain. Most bleeding strokes are caused by uncontrolled blood pressure, which is what my aunt actually had. She was taking her blood pressure for granted. Unfortunately, it went too high, and she had a hemorrhagic stroke. All right. But there are other reasons why blood vessels in the brain can become weakened too. Only 2 in 10 strokes are caused by bleeding. The majority are caused by clots. I hope you're writing this down. Only 2 in 10 strokes are caused by bleeding. The majority, so the 8 out of 10 of strokes, are caused by clots. And then ischemic strokes caused by blood clots. A small blood clot may form in a blood vessel and then block an artery in the brain. Sometimes this blood clot may develop in another part of your body and then travel in the blood vessels to the brain and get stuck, blocking the blood vessel. The medical term for this is an embolus. All right. I hope we're still together, great leaders, right? So now we've learned the different kinds of strokes and that children as young as infants, not just teenagers or early adults, children can also get strokes. All right, and you get various types of strokes. Hemorrhagic figures, the one that affects the eye, mini stroke or transient ischemic attack, otherwise known as TIA, hemorrhagic stroke caused by bleeding, and ischemic stroke caused by blood clots. Welcome, Leader Waymeni. Full stroke for 3 years now. We have tried everything we know, yet no way. She can't talk or walk. I do everything for her. What is your advice, please? Leader Waymeni, let us please save the questions for when it's question time, all right? Towards the end of the show, I give you the floor. So now we've done the types of strokes, all right? Now we're going to the signs of a stroke. So now, signs of a stroke, because stroke is usually not painful, patients may ignore the signs or symptoms and not seek medical attention in the hope that they will improve. Ladies and gentlemen, hoping is not the same as you going to your nearby clinic or to your doctor to make sure that you're in good health. So stop hoping, or you can hope, but hope with action. Action yourself by walking or driving to your clinic or your GP. All right. Acute stroke or TIA should be treated as a medical emergency and should be evaluated as soon as possible. You see, it's a medical emergency. So, what are the signs and symptoms of a stroke? The common signs and symptoms of a stroke are sudden weakness or numbness in face or in your arm or leg, most often on one side of the body, all right, on one side of the body, not both sides. Sudden loss of speech, difficulty speaking or understanding speech. So some of them, they slur. So like now I'm talking normally with you and then I start, that's a warning sign, all right? Then sudden confusion. Now you're confused how all of a sudden no longer, the vibrant person that you know or the usual person that you know. Suddenly you're just a confused person. That's one of the signs and the symptoms. And then sudden loss of vision. Remember we spoke about the first one, sudden loss of vision. When you go back to the types of stroke, here, the amaurosis fugax, where you lose vision. All right? It feels like light is fading and a curtain is being pulled over the eye. That's amaurosis fugax. All right? So those are one of the signs and the symptoms: sudden loss of vision, sudden severe unusual headache, and then sudden dizziness, loss of balance, and trouble with walking. So these, now in hindsight, and my aunt, before she was hospitalized, the signs and the symptoms that she had was the severe headache, and the confusion as well. All right, that's one of them. Now, there's something called FAST, FAST. This is very important, my leaders. Please take a screenshot of this. You need to act fast. It's a simple way to remember the signs of a stroke, and that it's important to seek medical help urgently. So, what is this FAST? The F is for face drooping. So, if one side of your face, doesn't matter which one, just one side, if it goes like that, it's a problem. All right. A is for arm weakness. S is for speech difficulty. So now you are slurring, and then T is time to call emergency medical services. T is very, very crucial. Time is very crucial when we're talking about stroke patients. All right. All right. Face. Ask the person to show. Remember, we're talking about fast here. The first one, face drooping. Ask the person to show their teeth or smile and see if one side of the face droops or does not move as well as the other side does. You'll find that it's normally difficult for them. They don't look normal like the way you are used to. And then with the arms, ask the person to lift both arms and keep them up and see if one arm does not move or drifts downward when extended. And then with a speech, ask the person to repeat a short sentence. Example, it's a sunny day in Cape Town. All right? Anything that comes to your mind that is simple. Just ask them to repeat it back to you. If it's difficult, it's one of the signs and the symptoms of stroke. And see if the person uses the correct words without slurring. Remember, slurring is part of speech. Remember, some of them, they go for speech therapy. And then time, make a careful note of the time of onset of symptoms and call for help urgently if you spot any one of these signs. And then emergency numbers. Okay, this is for leaders who are in South Africa. People experiencing one or more of these symptoms should seek emergency medical care immediately. So, the arm, you cannot control your arm, your face is drooping, you're having slurred speech, please, you definitely need to seek medical attention immediately. Medical help is most important within the first few hours after a stroke. Remember that time lost is brain function lost. So your first 3 hours, in fact, is the crucial time. All right. The faster you get the affected person to a hospital, the better their chances of survival and recovery. You could even save a life. So if you're calling from a cell phone, dear leaders, the number to call with your cell phone is 112. And if you're calling from a landline, the number to call is 10177. 10177. That's if you're calling with a landline. And go to your closest stroke unit or hospital emergency department. Stroke units have the equipment to correctly diagnose the type of stroke and specialized clot busting medication available to dissolve blood clots that stop blood flow to the brain. If you can reach a hospital with a stroke unit within 3 hours of the start of the stroke, go straight to that hospital as quickly as possible. If your life is in immediate danger or you live too far away from a stroke unit, then rather go to your nearest emergency hospital department. Are we together, leaders? So you need to act very fast when someone is close to you and you can see this person is, if you suspect that they're having a stroke. Better safe than sorry. Go send that person to the hospital or just call your emergency numbers. And then we need to know what are the causes of stroke. So as we said before, when we define stroke, anyone is at risk of having a stroke. The biggest risk factor for having a stroke is a high uncontrolled blood pressure. That's why they say hypertension, or aka blood pressure, is a silent killer. High blood pressure is a silent killer, along with thought. An abnormal heart rhythm called atrial fibrillation, or AFib, can also drastically increase the risk for a stroke. All right. However, most strokes don't not have a single cause, but rather many factors that together increase the chance of heart disease, which eventually results in a stroke. These factors that do not result in a stroke but contribute to its development are called risk factors. The more risk factors you have and the more serious the individual ones are, the greater the chance of a stroke. Risk factors for heart disease and strokes are similar because most of them cause the blood vessels to narrow, stiffen, and weaken. Welcome, great leaders. Leader Manyambosi, welcome, great leader. So, atrial fibrillation, AFib, what is it? Firstly, it increases the risk of potentially disabling or deadly ischemic stroke by nearly 500%. All right, welcome, Leader Ntwaki. AFib, or atrial fibrillation, increases the risk of potentially disabling or deadly ischemic stroke by nearly 500%. So, having AFib increases your chances of having a fatal stroke by 500%. Welcome, Leader Mildred. Atrial fibrillation is the most common sustained abnormal heart rhythm or arrhythmia. This dangerous arrhythmia causes the two upper chambers of the heart. Remember, we've got four chambers in the heart, okay? For those who don't know. So, arrhythmia causes the two upper chambers of the heart to quiver instead of beating effectively. So, they quiver instead of beating effectively, resulting in blood not being completely pumped out, which in turn causes pooling and can lead to clotting. These clots can travel to the brain, block an artery, and interrupt the brain's blood supply. This can trigger a major and often fatal stroke. Now, uncontrollable risk factors, things that you cannot do anything about, unfortunately. Some risk factors are out of your control, but can still make heart diseases and strokes more likely. Even though you can't change them, you should still be aware and control what you can. So, the most common uncontrollable factors are your age. Strokes become more likely with age. Do you see why it's so important to take long reach products? Because why? They are anti-aging. They slow down the biological clock some way. But it's not only about taking the product, it's also about other factors which we'll visit just now. So, sex, your gender. Women are slightly protected against strokes before menopause, but then their risk increases afterwards. So, after menopause, ladies, you are your risk of getting a stroke becomes higher. And then your genes. Rare forms of inherited high cholesterol, blood pressure, abnormal heart rhythm, or clotting disorders can increase the risk of strokes. So remember, these are uncontrollable risk factors. And then your family history. If your father or brother suffered heart disease or a stroke before the age of 55, or your mother or sister before the age of 65, then you could also be at increased risk of heart diseases or strokes. And then poverty is another uncontrollable risk factor. Well, but if you're in long reach, if you're in network marketing, we all know that this you can actually control. So poverty can increase stress, anxiety, and depression. Healthy lifestyle choices could also not be affordable or available, and good medical treatment could be inaccessible. Therefore, poverty is an important risk factor for heart diseases and strokes. So, leaders, please pump those PVs, recruit, or partner. Pump those PVs like our SD Esperanza, our new SD2. Get that money and control your risk factors. All right. Poverty is one of the risk factors for developing a stroke or heart disease. And then controllable risk factors. Okay, these increase your risk of stroke that you have the power. Okay, let me read from the beginning. Controllable risk factors as factors that increase your risk of stroke that you have the power to change. Up to 80% of strokes can be prevented by healthy living and medical treatment. But now, how do you get medical treatment when you are broke? You see, it's so important for us to actually understand that doing the business correctly is also very good and beneficial for our health. Even small improvements in each of these can make a difference. So we did, let me see, controllable risk factors. Okay, we just read that. AFib, we just read that it increases your risk of getting a stroke by 500%. Now, let us look at the uncontrollable risk factors here below. Pollution is one of them. This is important. This is why we need to take Longreach products, aka alkaline pickup, sea buckthorn berry oil. It protects us from pollution, which has what? Free radicals, right? That damage our bodies on a cellular level. Stress, uh, unfortunately, sometimes stress you cannot control, but it is out of our hands because life does happen. Smoking, smoking is actually a controllable risk factor. We can just stop smoking in its entirety. Just stop smoking and reduce your risk of developing CVD. All right, nutrition is one of the factors as well. Poor nutrition. Okay, leader Waimini, no problem, leadership. Nutrition also plays a huge factor because if you are not, remember I said in the beginning, I said um, when I explained what is stroke, that the brain needs continuous supply of oxygen and nutrition. Now, the problem here is the food, like I said last week, the food that we're eating, yes, it's food, but it's not nutritious. So it does not have the nutrients that your brain, your internal organs need. This is why it's so important for us to supplement with Longreach products, no matter which one, but Longreach products. All right, because the food that we're eating is not really food. All right, physical activity is one of the risk factors that you can actually control. Physical inactivity is very dangerous, leaders. You need to exercise at least 30 minutes over 5 days, and that translates to 150 minutes over a week. Your heart needs that. And remember, there is insulin that is actually activated by exercising. Without exercising, that insulin does not go to your muscles. All right. So you do definitely need to exercise so that the insulin travels to the muscles and does what it needs to do. So you need to exercise at least 30 minutes each and every day because why? Your heart needs it. Body weight as well. You need to control your body weight. You need to know your BMI. You can easily Google BMI and check if you are safe or not safe. Alcohol use as well, it increases your risk of developing CVD. Alcohol compromises your circulation. Alcohol also compromises your hypothalamus, the way that you think, your speech, and everything. So alcohol, I remember, I don't know if there's leaders who used to go to the training back in 2019. Remember, there was a leader called Baba Tulani. We used to call him Dr. Tulani, and he would say when you take alcohol, it's you taking poison for fun. And it actually took me a couple of years for me to understand. Kante Baba Tulani, what was Baba Tulani talking about? Here it is. Alcohol use is raises your risk of developing heart or stroke. All right. Diabetes is also a risk factor for having a heart or stroke, heart disease or stroke. Cholesterol, blood pressure as well. So cholesterol, blood pressure are circulatory disorders. There's many of them, but yeah, we'll just stick to what's on our screens right now. Great leaders, are we learning? So now we've done the causes of stroke. Now let's see how is stroke treated. So all patients with stroke need to be stabilized as soon as possible. in order to control any problems that may impair recovery. This includes careful management of hydration, so water, hello, water. Remember, we drink water, but there's different kinds of different quality water. The best quality water is from alkaline pickup. That also matters. Remember, the alkaline pickup also jam packs your water with nutrients that your body needs, namely potassium, vitamin C, um, uh, 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 um, sure, the alkaline pickup has got so many nutrients. Calcium is also one of them. All right. Calcium also regulates your heartbeat. Remember that. All right. So this includes careful management of hydration, nutrition, and swallowing problems, as well as measures to prevent pneumonia and blood clots forming in the veins of the legs. Ish, we don't want that. Ne? High blood pressure and blood sugar levels may require treatment. A stroke patient may require oxygen for difficulty breathing. After the acute phase of stroke treatment, the focus of management shifts to rehabilitation and preventing another stroke from occurring. All right. After the type of stroke was correctly diagnosed, some specialized treatments may be considered depending on the patient's condition and the services available. Hey, remember that's another one, eh? Unfortunately, in Africa, we still have a long way to go when it comes to the advancement of medicine or medical services, but we're on the right track. So, making a correct diagnosis of a stroke, the ambulance staff or the doctors will do a clinical evaluation and request tests to determine what type of stroke you suffered. Remember, there's different kinds of stroke. The initial evaluation of a suspected stroke involves checking your vital signs, all right, such as blood pressure, your heart rate, and respiration and stabilization of the patient. Tests to determine the type and severity of a stroke can include blood tests or an ECG. Imaging tests are often done to produce pictures of the brain and include CT scans or MRI scans of the brain and a carotid Doppler ultrasound scan that shows the blood flow to the brain. These are important stuff, great leaders. And then there's emergency clot dissolving treatment. Some patients may be eligible to receive medication that can dissolve or break up the clot that is obstructing an artery. This medication is called tissue plasminogen activator or TPA treatment. TPA is commonly known as clot buster treatment. TPA should be given at hospitals with stroke units that have scanning facilities. TPA can only be given to patients who are having a stroke caused by a blood clot, and it must be given within 4.5 hours of the start of the stroke symptoms. In some cases, TPA cannot be used. Remember, great leaders, we said 3 hours of you or the person getting stroke symptoms. That is the most important window of um, when you can get treatment. Okay, that's the important window. That 3 hours is the important window of how fast and efficiently they can help you, right? Because the longer the time goes, the longer your condition, the worse your condition actually worsens. All right. Then physical removal of a clot in the brain. In some patients, a large blood clot can be physically removed during a procedure called a mechanical thrombectomy. This, this procedure can only be done in very specialist centers where they have the correct scanning equipment, treatment facilities, and trained specialists to undertake the procedure. Mechanical clot removal can typically only be attempted under specific circumstances and within 6 hours after a stroke occurred. You see why it's so important. Time is important. And then operations for TIA or stroke, the transient ischemic strokes, an operation called a carotid endarterectomy may be carried out by specialist doctors on narrowed blood vessels in the neck. Should you need an operation, you will be seen by a specialist who will explain what it involves. However, most people are given tablets and asked to change their lifestyle in order to help prevent further strokes. In most cases of TIA, this is not necessary. and then emergency surgery, sorry, after a hemorrhagic stroke. The aim of the hemorrhagic stroke is to stop the bleeding and stabilize the patient. In some cases, surgery may be needed to remove blood that has pooled in the brain. Very specialist procedures can sometimes be undertaken to fix burst blood vessels. So, great leaders, I don't want to bombard you too much about this. I want to play a video and then we'll come back to the risk factors. Okay. Are we learning? I hope we're learning. I really hope we are learning. Where is it now? I see there's time. This is a 5-minute video by a doctor from Mayo Clinic who explains strokes so nicely in literally 5 minutes. You'll see what I've just said, but he's literally summarized it. All right. Good morning, Madam Sirana, Prof. Mankolo, PS Karin, welcome leadership.
You've likely heard the term stroke before. They affect about 800,000 people in the United States.
Let's start from the beginning.
I'm Dr. Robert Brown, neurologist at Mayo Clinic. In this video, we'll cover the basics of a stroke. What is it? Who it happens to? The symptoms, diagnosis, and treatment. Whether you're looking for answers for yourself or someone you love, we're here to give you the best information available. You've likely heard the term stroke before. They affect about 800,000 people in the United States each year. Strokes happen in two ways. In the first, a blocked artery can cut off blood to an area of the brain, and this is known as an ischemic stroke. 85% of strokes are of this type. The second type of stroke happens when a blood vessel can leak or burst, so the blood spills into the brain tissue or surrounding the brain, and this is called a hemorrhagic stroke. Prompt treatment can reduce brain damage and the likelihood of death or disability. So if you or someone you know is experiencing a stroke, you should call 911 and seek emergency medical care right away. Anyone can have a stroke, but some things put you at higher risk and some things can lower your risk. If you're 55 and older, if you're African American, if you're a man, or if you have a family history of strokes or heart attacks, your chances of having a stroke are higher. Being overweight, physically inactive, drinking alcohol heavily, recreational drug use, those who smoke, have high blood pressure or high cholesterol, have poorly controlled diabetes, suffer from obstructive sleep apnea, or have certain forms of heart disease are at greater risk as well. Look for these signs and symptoms if you think you or someone you know is having a stroke. Sudden trouble speaking and understanding what others are saying. Paralysis or numbness of the face, arm, or leg on one side of the body. Problems seeing in one or both eyes. Trouble walking, and a loss of balance. Now, many strokes are not associated with headache, but a sudden and severe headache can sometimes occur with some types of stroke. If you notice any of these, even if they come and go or disappear completely, seek emergency medical attention or call 911. Don't wait to see if symptoms stop, for every minute counts. Once you get to the hospital, your emergency team will review your symptoms and complete a physical exam. They will use several tests to help them figure out what type of stroke you're having and determine the best treatment for the stroke. This could include a CT scan or MRI scan, which are pictures of the brain and arteries, a carotid ultrasound, which is a sound wave test of the carotid arteries, which provide blood flow to the front parts of the brain, and blood tests. Once your doctors can determine if you're having an ischemic or hemorrhagic stroke, they'll be able to figure out the best treatment. If you're suffering an ischemic stroke, it's important to restore blood flow to your brain as quickly as possible, providing the oxygen and other nutrients your brain cells need to survive. To do this, doctors may use an intravenous clot buster medicine, dissolving the clot that is obstructing the blood flow. Or they may perform an emergency endovascular procedure. This involves advancing a tiny plastic tube called a catheter up into the brain arteries, allowing the blockage in the artery to be removed directly. Unlike ischemic strokes, the goal for treating a hemorrhagic stroke is to control the bleeding and reduce pressure in the brain. Doctors may use emergency medicines to lower the blood pressure, prevent blood vessel spasms, encourage clotting, and prevent seizures. Or, if the bleeding is severe, surgery may be performed to remove the blood that is in the brain. Every stroke is different, and so every person's road to recovery is different. Management of a stroke often involves a care team with several specialties. This may include a neurologist and a physical medicine rehabilitation physician, among others. Now, in the end, our goal is to help you recover with as much function as possible so that you can live independently. A stroke is a life-changing event that can affect you emotionally as much as it can physically. You may feel helpless, frustrated, or depressed. So look for help and support from friends and family. Accept that recovery will take hard work and, most of all, time. Strive for a new normal and remember to celebrate your progress. If you'd like to learn even more about strokes, watch our other related videos or visit mayoclinic.org. We wish you all the best.
Thank you, Dr. Brown. Partners, are we still together? What happened now? Where did I go? Where did I not go? Okay. Are we still together, leaders? All right, looks like we're still together. Now, we're going to revisit the risk factors. All right. Hey, this thing's not stable. All right, so the burden of cardiovascular disease. Now, this is directly from the Heart and Stroke Foundation, right? The Heart and Stroke Foundation, South Africa. Thank you, Sir Richard. All right, let me just read these stats. Globally, CVD or cardiovascular diseases take more lives than TB, tuberculosis, HIV, and malaria combined. So I'm reading it clockwise from the left. Heart disease and strokes are South Africa's biggest killers after HIV and AIDS. South Africa has one of the highest levels of overweight and obesity in the world, which is a contributing factor for heart disease. Every hour in South Africa, 5 people have heart attacks and 10 people have strokes. Every hour. This is not a joke. 80% of premature deaths, so this is before the age of 60, 80% of premature deaths can be prevented with a healthy diet, regular exercise, and avoiding smoking. All right, remember, smoking constricts it compromises your circulation. So it constricts the blood vessels. We do not want that. More South Africans die of CVD than of all cancers combined. Let me read that again. More South Africans die of cardiovascular diseases than of all cancers combined. So we combine all these nice cancers, if you want to call them nice: prostate cancer, cervical, breast cancer, ovarian cancer, all of them combined, they still fall short of CVD. And then globally, CVD kills over 17.3 million people every year. 17.3 million people die every year from CVD. That's almost the population of the Netherlands. All right. So we're going to the risk factors, the burden of cardiovascular diseases. So we just read the stats. Okay. In South Africa, I'll read again because it's important. CVD is the leading cause of death in South Africa after HIV and AIDS. Most South Africans die of CVD than of all the cancers combined. CVD is responsible for almost 1 in 6 deaths in South Africa. 215 people die every day from heart disease or strokes. 215 people every day die from heart disease or strokes in South Africa. Every hour in South Africa, 5 people have heart attacks, 10 people have strokes, and of those events, 10 people will actually die from it. Now, the risk factors, we're going back to hypertension, high blood pressure. This is the leading risk factor. It's the leading, so risk factor number 1 on the list for death for CVD, responsible for 13% of deaths globally. Of the various risk factors contributing to CVD, hypertension has the largest impact. Yes, so this is why I'm only addressing questions that have to do with CVD. Hypertension is the leading risk factor for stroke in South Africa, responsible for 1 in 2 strokes and 2 in 5 heart attacks. Let me read that again. Hypertension is the leading, so high blood pressure is the leading risk factor for stroke in South Africa, responsible for 1 in 2 strokes, so 50%, and 2 in 5 heart attacks. 1 in 3 South Africans 15 years and older have high blood pressure. 15 years. So little kids from 15 years, they have hypertension. To add to this problem, more than 50% of people with high blood pressure are unaware of their conditions. The same with sugar, with diabetes as well. All right, more than 50% of people with high blood pressure are unaware of their condition. Of the people diagnosed with high blood pressure, only a third is on treatment. A third. What about the 2/3? And of those, only a third has adequate control of their blood pressure. South Africa has the highest rate of high blood pressure reported among people aged 50 and over, over 50 and over for any country in the world at any time in history, with almost 8 out of 10 people in this age group of 50 and over being diagnosed with high blood pressure. 1 in 10 children are already suffering from high blood pressure. These are South African stats. All right. And then overweight and obesity, about 2 out of 3 women, and almost 1 in 3 men are overweight or obese in South Africa. 40.1% of women are obese compared to 11.6% of men. 1 in 10 males have a waist circumference that's about 102, that's greater than 102 centimeters, while on the other hand, 1 in 2 of females have a waist circumference that's greater than 88 centimeters. Waist circumference is a measure of abdominal obesity and is defined as a circumference that's larger or equal to 102 centimeters in males and 88 centimeters in females. So, ladies and gentlemen, so men, measure yourself today, check your waist. If you are more than 102 centimeters, you are high risk. Females, if your waist is more than 88 centimeters, you are high risk for developing CVD. All right. 2/3 of adults appear to be happy with their weight, and almost 9 out of 10 agree that their ideal body image was being fat. Hey, this goes back to our African culture as well, right? Almost 1 in 4 children aged between the age of 2 and 14 years are overweight or obese in South Africa. Overweight and obesity is significantly higher in girls than in boys. Overweight or obese children have an increased risk of developing these diseases earlier in life and are more likely to remain obese throughout their adult life. Are we together, great leaders? And then high cholesterol. 1 in 4 adults have high cholesterol and LDL cholesterol, and 1 in 2 have low HDL cholesterol. And then in a national survey, only 4.2% of respondents were aware they had high blood pressure. They had high blood cholesterol. I mean pressure. Only 4.2% of respondents. So what about the 96.8 about the 96.8 were not aware that they have high blood cholesterol. And then diabetes. Almost 1 in 10 adults are diagnosed with diabetes, and almost 1 in 5 adults has impaired blood glucose control. 1 in 2 people don't know they have diabetes. 1 in 2. So, in other words, if there's 10 of us, 5 of us probably have diabetes. The other 5 don't have it, but yeah, it's a risk. And then smoking, tobacco use. Globally, nearly 6 million people die from tobacco use. Globally, nearly 6 million people sorry, die from tobacco use or exposure to secondhand smoke each year. We talk about annual stats here. 6 million people die from tobacco use from either smoking or secondhand smoking every year. Smoking is the second leading cause of CVD after high blood pressure. Are we learning, grade leaders? There's no risk-free level of exposure to secondhand smoke. Non-smokers who breathe in the secondhand smoke have between a 25 to 30% increase in the risk of developing a cardiovascular disease. Globally, each year, exposure to secondhand smoke kills 600,000 people, of which 28% of them are children. Of all adult deaths caused by secondhand smoke, more than 80% are from cardiovascular diseases. In South Africa, 1 in 5 adults report a history of ever having smoked tobacco, and 1 in 5 report being exposed to secondhand smoke on a daily basis in their homes. The mean age of initiation of tobacco smoke was around 17 years. So kids start smoking plus minus around the age of 17. All right, that's the kind of a hey man, there's an English word. I'm looking for it, but now it's not coming. Hi. 1 in 5, moving on. 1 in 5 adolescents smoke currently in South Africa. 1 in 5 adolescents smoke currently in South Africa. And about 6.8% of adolescents smoke their first cigarette before the age of 10 years. So before our kids are even 10 years, boys mostly, they've already started smoking or started playing around smoking. And then physical inactivity in South Africa, over a quarter of men and almost half of women are physically inactive. 1 in 3 adolescents spend 3 hours or more per day watching TV, and only 1 in 3 adolescents participate in sufficient moderate intensity activity. And then we go back to the diet. Unhealthy dietary practices are putting South Africans at an increased risk for CVD. It's not only South Africa, all right? Because most of the world have adopted the Western diet. So what is this? Poor intake of fruit and vegetables. So think about our shakes, our Nutrivi Pink and Blue shakes. High and increasing fat intake, reduction in milk intake, overall increase in total energy intake. So they take too much energy foods, but of the bad kind. High and increasing alcohol consumption. We all know that we have a problem of alcoholism in the country. Low fiber intake due to low intake of fruit, vegetables, and legumes, and high salt intake. There are just some people, before they even eat, they've already put in the salt on the food without tasting the food. So that's also very dangerous. It also causes water retention. Almost 1 out of 5 adults consume a diet with a high fat score and high sugar score. That's the Western diet. And 1 out of 4 consume a diet with a low fruit and vegetable score. More than half of the children did not take a lunchbox to school. That's a problem. Over 2/3 of adolescents consume fast food. So there's cambanes, the kotas, there's patos, you know, at least 3 times per week, and 2 in 3 bunny chow in English, and at least 3 times per week, and let me start over. Over 2/3 of adolescents consume fast food at least 3 times per week, and 2 in 3 learners purchase sugar sweetened beverages at least twice a week. Now, the problem with salt. South Africans eat 6 to 11 grams of salt every day, double the recommendation of no more than 5 grams per day. This by the World Health Organization. More than half of the salt South Africans consume comes from processed foods. This is not just South Africa, this also includes America, which contain hidden salt. 40% of salt consumed is discretionary salt, added during cooking and at the table, the dinner table. Now, in South Africa, the top contributors to daily salt intake are the following: breads, all types of breads. All right, this is the single greatest contributor to sodium intake. Remember, salt is called sodium. So yeah, it is the single greatest contributor to sodium intake among different ethnic groups, contributing to 5 to 35% of sodium intake. And then processed meat products, so your balonis, your sausage rolls, your Viennas, processed meat got lot of salt. All right. Your soup gravy powder, you know the ones that we love to cook with, soup gravy powder, contributing up to 17% of sodium intake. And then meat and vegetable extracts. So think about kind of what you call beef stock. Very, very salty, that thing. Hard or block margarine, contributing up to 13% of sodium intake. Savory snacks, including crisp mazimbas, you know, the Simba snacks. Breakfast cereals, believe it or not, also have salt in them. And acha can contribute more than 5% of sodium intake in the Indian population. I think in general, even in the black population, because people are so obsessed with acha. All right, so great leaders, the products that you can take as a long reacher are our long reach teas, the brown tea, the green tea. Now, if the person needs to lose weight, it's only then you can recommend the pink tea, all right? Otherwise, green tea, brown tea. The other nice part about our teas is that they are high in fiber, all right? In other words, they have high nutritional value. Remember what I said? The food that we eat, yes, it's food, but it's not nutritional. So we can get the nutrition from our long reach teas. All right, our long reach teas, they also help fight against the leading causes of death globally, which are your CVDs, your chronic obstructive pulmonary diseases, lower respiratory infections, etc. All right. And remember what I said just a little bit earlier, who reports that Africa has the highest rate of high blood pressure in the world. So you need to recommend the teas. All right. They're good for diabetic patients. They're good for blood hypertensive patients. Moving on. Then we have our cordyceps coffee. All right. Our cordyceps coffee, very good in minimizing the risk factors. All right, the risk factors of CVD, because it's got vitamin E, it's got vitamin K. Vitamin K. Let me read this. The body needs vitamin K to produce prothrombin, which is a protein and clotting factor that is important in blood clotting and bone metabolism. Remember, we spoke about blood clotting. Remember, we're speaking about stroke. So please, I recommend the long reach cordyceps coffee for sugar diabetic patients, stabilizes the sugar, for hypertensive patients, all right? And the great part is that it's also anti-aging. and also very good for gut health. All right, aka leaky gut. All right, and so are our teas. Arthrosap Reviver is also excellent. All right, for stroke survivors. All right, Arthrosap Reviver is also great for those who have type 2 diabetes. All right, it's got something called glycoprotein, all right, which is very good for people with diabetes. Are we together, great leaders? The other product that you can recommend is obviously our sea buckthorn berry oil, the soft gels. This is a supplement that actually every Longreach member should be on. All right, every Longreach member, whether you're sick or not, believe me, you'd be so surprised. There's a lesson that I'm going to do, I don't know when, where I'm actually going to show you that we are all actually in danger of developing some form of disorder or autoimmune disease. So all of us actually need to be on the sea buckthorn berry oil every single day, all of us. Whether you're healthy, you feel healthy, or you don't, you need to be on the sea buckthorn berry oil and to drink water from our alkaline backup and supplement with either the green tea or the brown tea. Pink tea if you need to lose weight like myself. All right, the berry oil is jam packed with a lot of nutrients that help to protect you from developing heart disease, all right, and stroke. All right, are we together, great leaders? So you need to be on berry oil whether you like it or not. Remember, the berry oil is also high in it's 100% vegetarian. So translating it, or the other nice part is that it's gluten free. So this is also very good for those who have celiac disease, which is a form of disorder for the intestine. All right, celiac disease. All right, there are just some people who are just yeah, they just can't take it. So this is another product that you can recommend to people who have celiac disease. So we all actually need to be on the sea buckthorn berry oil, healthy or not healthy. It's jam packed with potassium, with calcium, magnesium, iron, and phosphorus. Vitamin E as well, which is anti-aging, folic acid, which is very good for DNA support and repair. Right, pregnant women should also be on the berry oil. Moving on, I'm looking at the time. All right, I've spoken about the alkaline backup already, so I'm not gonna say much about it, except that yeah, we all need to have the alkaline backup. It's a disservice unto yourself if you are a Longreach member and you do not have the alkaline backup. All right, come to my academy, you'll understand even better. All right, so great leaders, are there any questions? I will address, me start with that leader Wameni. There were many great leaders. That's all for tonight on strokes. Those are the products that you can recommend to your loved ones, to your prospects, maybe. Yeah, but leader Wameni. Hey, I want to say it right. Sorry, I don't like mispronouncing names. Okay, I'm gonna show them. So, first question. My mom has been in full stroke over 3 years now. We have tried everything we know, yet no way. She can't talk or walk. I do everything for her. What is your advice, please? So you see, great leaders, that stroke affects the entire family. So great leader, it sounds like yeah, unfortunately your mom, her stroke was severe. All right. But these are the following products that you can let her use, you can give to her, and hopefully over time, you say it's 3 years now. I'm going to give a recommendation that you should stick to for at least 12 months. So your mom, you need to firstly do not mix Longreach products with her prescription medication. All right. Do not mix any Longreach product with prescribed medication from the doctor. Allow for at least an hour. I say an hour, not 30 minutes. All right, because some medication takes longer than 30 minutes to digest. All right. So Mama needs to, firstly, for 3 days, she needs to detox with our longish green tea, but she must never stop. All right. Give her just a cup every day thereafter. Then after detoxing for 3 days, morning and night, give her a cup in the morning, a cup at night. Then Arthrosub Reviver and berry oil. Obviously, the alkaline pickup has to be there. But if possible, try to get her either the energy shoes or the energy necklace. All right, because your mom is a severe case. This recommendation is for you specifically for your mom for the next 12 months. Great leaders, are there any other questions? Training is over. Now the floor is yours. So Leader Wamene, I hope that I have been helpful. We need to revisit this topic. Please inbox me. I want to know what's the progress. Every month, inbox me and let me know after Mama has started with her recommendation. All right. So the green tea, excellent. Remember, I did not mention the cordyceps military supplement because it is a natural blood thinner, and normally, you saw they gave people normally they give people with heart conditions some form of blood thinner, right, like warfarin, for example. So we do not recommend the cordyceps militaris supplement for heart patients. Rather, give them berry oil. All right. Are there any questions, great leaders? I'm looking at the time. You have 60 seconds, give or take. Did you enjoy the training? I hope you learned a lot. And please note, December is my last month of training in the Health Hub. My 2023 is very, very packed, eh? So I will no longer be doing any trainings on Mondays. You'll have to catch up on all the trainings that you've missed. There's trainings for the next 5 years or so. Yeah, my calendar for 2023 is too packed. I cannot go on with the Health Hub anymore. All right. So please note that these are the last few trainings that I'll be doing live going forward. So December is my last month. So please, I encourage you to attend these trainings because they are free. You don't have to pay anything, unlike if you come into my academy where you actually have to pay. All right. So take advantage of the Health Hub because the Health Hub is free. All right. All right. So great leaders. Okay, it's just gone 8:15. I see there are no questions. Thank you so much for your time, great leaders. We'll meet next week. Next week's topic is quite something I've never touched before, but I'm not even going to tell you what it is. I'm not going to tell you what it is, but yeah, it's quite exciting next week. So I hope that I'll meet you here next week, Monday, 7 until 8 o'clock or thereafter. It will depend on how hectic the session is. Thank you so much, ladies and gents, for your time. Do take care. Remember, your health is your wealth. Exercise, supplement with long reach products, and just adopt a healthier lifestyle and less of drinking alcohol. Adios.